All right, guys, welcome today. Once again, we are going to have it once again. If you watch my recent videos, I've been talking about drugs you can use to take care of hypertension, of which we mentioned amlodipine, we mentioned Vasartan, hydrochlorothiazide, and then there's another drug we're going to be dealing with today, which is called clopidogrel. Clopidogrel, remember, is not an antihypertensive drug. Clopidogrel is just an antiplatelet. Okay, so here are the guides we are going to use today to study about this particular medication, and also why we normally co-administer it with antihypertensive medications. So the first thing we're going to be considering today is the class of this clopidogrel, the mechanism of action, the indications, the side effects, the contraindications, the dosage, the routes, the drug interaction, the nurse's responsibilities, and patient education. So please, I want you to follow me right now. We are going to start from the class. We are taking it one after the other. So like I said, the class of drug where this clopidogrel belongs to is antiplatelet. Please, it's not anticoagulant. There is a big difference. Antiplatelet. I hope you have your writing material, because you're going to learn a whole lot from these particular medications. You're going to be sounding professional after learning what I'm about to teach you. So it's antiplatelet. That reminds me, the generic name of this drug is clopidogrel, while the brand name is Plavix. Plavix is the brand name, right? Now we're going to go into the mechanism of action. Okay, now when this clopidogrel is taken through the mouth, it goes to the stomach. From the stomach, it moves to the intestine. From the intestine, it moves to the liver. The reason why this drug needs to get to the liver is because clopidogrel is a prodrug. Is a prodrug. The active form of clopidogrel is called active thiometabolites. Active thiometabolites. That is the active form of this drug. So when it gets to the liver, it's going to be converted from clopidogrel to active thiometabolites by an enzyme called cytochrome P50. Now, this active form of this clopidogrel now is going to bind on a receptor called P2Y12 receptor. This receptor is a protein that is found on the surface of the platelet. The main work of this protein actually is to bring about growth and aggregation of platelets. So when clopidogrel binds to it, it will inhibit the action of P2Y12 receptor, and then clotting will cease. So when active thiometabolites binds to P2Y12 receptor, what it's simply going to do is that it's going to block the growth and the aggregation of platelets. This is the conclusion of the mechanism of action. I hope we get it. So I'm going to wipe the board. Please always have these videos on repeat so that you can grab what I'm saying. So let's go to the indications. Indications are the reason why we are taking this medication. Number one indication is myocardial infarction, as heart attack. Myocardial infarction. We have ischemic stroke. Let's add hypertension, because that is one of the reasons why we are having it here. Now, this drug, one of the side effects of this drug, please follow me. The side effect of this drug is whenever you're taking this drug, you easily have bruises. Any little stain on your skin, you're going to bruise. You're going to be susceptible to nosebleed. So, bruising, please just be copying it. Bruising, then nose bleeding, you're going to see something like rash. etc. So let's go contraindication. You have hypersensitivity reaction, which is allergy. If you're allergic to clopidogrel, please, you don't have to take it. If there is active bleeding, that's example, peptic ulcer or intracranial hemorrhage, please, you don't need to take clopidogrel. So on the dosage, we have for bolus, we have 300 to 600 milligram once daily. The maintenance dose, 75 milligram once daily. Are you with me? Now the next thing is the roots. The root is oral by through mouth. The next thing we are going to be talking about now is drug interaction. Now in this drug interaction, I want you to pay attention. Now if you are taking a proton pump inhibitor like omeprazole, please, you don't need to co-administer with clopidogrel. You don't have to do that. If you're taking proton pump inhibitor, if you're taking NSAID, ibuprofen, diclofenac, you don't need to co-administer it with clopidogrel. That is for the drug interaction. Now for the nurse's responsibilities, please, after observing the right dose, the right route, the right patient, the right medications and everything, please always assess for bleeding. Always assess for bleeding. It's very, very important. Bruises, very, very important. Yes, patient education. Now the first thing you need to consider is that tell the patient to take this medication the same time every day. If it is 8 o'clock today, the next day by 8. The second thing is don't stop this medication or don't stop taking this medication without doctor's consent. You don't just wake up and then you stop taking this medication. Don't do that. And then avoid anything that will bring about bruising, because this medication will make you susceptible to bruises. Now, this is a take home. I want you to pay attention now. Why are we co-administering antiplatelets with antihypertensive medication? Why? Now, hypertension or high blood pressure, what it does is that in most cases, it destroys the epithelial tissues of the blood vessels. It destroys the epithelial tissues of that is the lining. This is the lining of the blood vessel. So due to the force the blood is coming with, it begins to affect the epithelial linings here. And then when these epithelial linings are affected, it's going to activate the production of platelets. I know once platelets enter here, clots begin to set in. So you have to administer clopidogrel so that the clot will not set in from these platelets. So that is the main reason why sometimes when they give you amlodipine, give you Vasatab, give you hydrochlorothiazide, they only give you clopidogrel so that in aspect of blood clotting, clopidogrel will prevent it. Thank you very much. I want you to comment, like, share. Please support me. Thank you.